वेलकम टू दिस एपिसोड ऑफ द हरप्रीत सिंह शो सिनी 2018 कॉन्फ्रेंस चल रही है तो ਅਸੀਂ ਪਹੁੰਚੇ ਹੋਏ ਹਾਂ ਸਾਈਮਨ ਫਰੇਜ਼ਰ ਯੂਨੀਵਰਸਿਟੀ ਮੇਰੇ ਨਾਲ ਸਾਥ ਦੇਣਗੇ ਡਾਕਟਰ ਕੈਂਡਲ ਹੋ ਜਿਹੜੇ ਕਿ ਯੂਨੀਵਰਸਿਟੀ ਆਫ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਵਿੱਚ ਪੜ੍ਹਾਉਂਦੇ ਨੇ ਤੇ ਉਸ ਦੇ ਨਾਲ ਹੀ ਆਈਕਨ ਪ੍ਰੋਜੈਕਟ ਇਹਨਾਂ ਵੱਲੋਂ ਚਲਾਇਆ ਜਾ ਰਿਹਾ ਹੈ ਆਓ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਡਾਕਟਰ ਕੈਂਡਲ ਹੋ ਨਾਲ Doctor, welcome to the program.
Hi, thank you. Thanks for having me again.
Thank you. It's a pleasure. Always a pleasure to have you on the show and learn more about what all is being done. Probably you are one of the pioneers, I would say, where you had started focusing on the preventive aspect as to create awareness in the community that prevention is better than cure. We had been reading it, but you took the initiative and ICON project was launched. How many years has this project been on, and what all is the latest, what is being done?
Yeah, Harpreet, thank you so much. Again, fantastic to be on the show again. And in fact, our ICON initiative, which is trying to provide our community members with knowledge about their illnesses so that we not only have primary prevention so that they don't get the disease, but also secondary prevention. Even if they have the disease, how they live well so they don't need to go into emergency department and hospitalized. We started that in 2007.
Wow.
In fact, the planning of it, but our first event was actually 10 years ago. So this is actually our 10-year anniversary.
Wow, congratulations.
And, thank you. And Harpreet, we knew each other since 2010. It's just amazing. So thank you so much for working together on that. And so what we want to do is we want to support our patients so that and our community members so that they can do self-management the best, and also as health professional we can help them to support their wellness.
So using technology, because now times are changing and everybody doesn't have the time every time to go and see a doctor, so you organize conferences where you get a panel of doctors, they interact with the common people and then their questions are addressed. And this every year you hold this conference. But apart from that, you're also using technology so that people sitting at their home or on their iPhones only, they can download those apps and start using them. What has been the response for that?
Yes, it's been tremendous. Since 10 years, technology has evolved so much. We started with using the web to just share some of the information. And of course, we evolved into the opportunity to actually webcast our events so that people go on the web can actually look at and interact with the events. And then we moved on really when historically apps, there was a previous platform called Palm Pilot. So that was the original apps. But really, Apple devices have popularized apps. And so again, we've been over the last 6 to 7 years started to introduce apps, suggest that to our general population, caregivers, and patients so that they can use for self-management of technology. And in the last 4 years, in fact, one of the wonderful opportunity here at the conference is present in the last 2 years, we've now introducing wearables for our patients so that not only can they use it to measure themselves, but as health professionals, as hospitals, as health systems, we are now sending them home with sensors, watch them recover. And in fact, we've demonstrated there was a good 59% reduction of readmission to hospitals because of use of sensors and wearables. It's a very, very exciting time.
That's really interesting. So as far as the apps are concerned, just to go through them, what are the major apps which you have introduced, which people can download on their phones and take advantage of?
Yeah. In general, there are several kinds of apps that people use. Number one is they track their exercise. So either the amount of steps they walk or bicycle, how far they bicycle, what type of activities associated with it. So that's one general area. The second area is tracking their physiologic signs. For example, how fast their heart goes, how much they breathe, how long they sleep. So I think those are tracking in terms of the type of body signals that you have. The third is behavioral tracking. So how much do I eat? How much calorie do I put in? How do I feel emotionally? And what's our fluctuation over the days and emotions? Those are three most common types of signals that we'll use to track.
So for this, can the people just go to the app store and put the name of some, is there any specific app which they need to download, or there are many in which they can download?
Absolutely. Usually what we recommend, there are many apps, like 40,000 apps, health apps out there. So it's very impossible to actually recommend all of it. But when I talk with my colleagues, medical colleagues, health colleagues, What we need to do is to learn those apps ourselves,
Right.
to actually try it ourselves, and then recommend to our patients.
Right.
And then also we learn from our patients, because sometimes they'll come in and say, well, I use this app.
Right.
I need to learn from the patient, why do you use this app?
Right.
What do you use it for? And I can then help the patient to learn it. And so in ICON website, we now have several of those apps that we've tried out, we
Right.
work with our patients, that we can recommend to our audience. But we welcome the audience. As you use apps, recommend it back to us, so
Right.
we can also learn with you.
So the website for ICON is?
It's iconproject.org, iconproject.org.
Right. And also the conferences which you have been taping, is there some segment of that on the website where people can go and again listen to that?
Absolutely.
Okay.
So all our previous conferences, for example, on diabetes, on stroke, on heart failure, it's all on the web.
Right.
We also have a segment called digital health.
Right.
And so again, we introduce apps and introduce different ways that you can use technology.
Right.
And most recently, we had an international conference also on the website talking about emerging technology, like wearing a hat to check your brain health and give your brain index on it.
That's
So
interesting.
those are some of the things that you can find out on the website.
Okay, that's really interesting. So I would say the foundation has been laid by ICON Project, whereby you've started interacting, and especially with the South Asian community also, there's been a tremendous response to your conferences where people come, they interact with you, and then of course, through these digital apps, they take advantage. What are you focusing on now? What is in store for us in future? Will people sitting at homes also will be able to interact with their doctors directly? Because we had some panelists from India who were saying in rural villages now, people can sit at homes and they can just log on and they can talk to the director personally. Are we seeing this in future in Canada also?
Definitely so. In British Columbia, there are a lot of really exciting opportunities going on. I'm going to step back for a second before I go back in that area. Again, really thanks to you, thanks to the community, the South Asian communities who were able to connect with you, and thanks for trusting us so that we can build this relationship. Because at the end of the day, healthcare is about relationship.
Absolutely.
And so it's just tremendous for that. I think technology can help, but technology use has to be based on relationship.
Right.
Now, building on that, there's some really exciting stuff happening. For example, using text messages so that you can communicate with your health professionals, so that you can have an image, and then with the image, with text messaging, we can actually deliver the type of health.
Right.
And also, for example, escalate to something like FaceTime, so that we can securely have a conversation, so that we can treat our patients at home. Now, obviously, there are certain things that we do need to see patients face to face. We can't use the mobile phone to check the stomach and push on the stomach. We can't do that. Not yet.
Absolutely.
But how can technology be used optimally so that we can support our patients at home? It's going to be very, very important. And so that virtual health is developing. And then also not only actively talking, but also passively tracking you with the data. And so the sensor and wearables that we talked about, discharging patients home, I think that's going to be a really important area, so that patients can have the comfort to know that with their data, our health professionals monitoring with them. And then finally, on the conversation between health professionals and patients, these conversations behind reveal not only the facts, these are, I'm feeling short of breath, etc., but we can start to detect emotions. I'm starting to get anxious now. I'm starting to worry now. I'm starting to get depressed, so that we can, as health professionals, work with our patients based on the relationship, so that we can improve their health.
Wow, that's going to be very interesting times in future, and definitely what we are seeing, that the foundation has been laid, and now you are building that building on that foundation. Towards the end, these kind of conferences, CINI 2018, what kind of impact can these have, and what do you think, what you are observing, you have attended these sessions, what would be your message to our viewers today?
Yeah, I want to first thank Dr. Garg. I think he's just tremendous energy in building the synergy between India and Canada. I think there are three things we can learn from this. Number one, culturally, how do we as Canadians exchange with people from India, and also understanding how the background of India, the culture of India, influence how we live in Canada. As health professionals, we need to understand that background. So on the cultural level, it's very important. Secondly, on a technological level, to understand that there is population in India, population in Canada. how can we look at the similarities
That's
of
right.
how technology used and the differences?
Right.
What are some of the differences that technology need to be understood as we apply into technology?
Right.
But the third is also very important, is to understand how do we integrate it into the health system and how do we sustain that. And that's when we need governments, that's when we need hospitals,
Right.
that's when we need Fraser Health, and that's when we need health authority to work together.
Right.
So that not only do we invent new technologies, not only do we support our patients, but how do we actually integrate into our health system and understanding culture so that we can actually, as two countries, as globally, we can actually use this technology to support health.
Wonderful. It was a pleasure talking to you. Thank you very much
Thank
for
you
this
so much.
information.
Yeah.
And we are sure that with your dedication and hard work, interesting times are coming future also, and we can take advantage of it. Thank you very much.
And again, thank you so much. Thank you.